In 2012, over 300,000 people went into cardiac arrest outside of the hospital. Of those, 11.4% who were given successful bystander cardiopulmonary resuscitation, or CPR, survived. Using modern science and research of prior techniques, CPR has developed and is developing into a crucial technique for resuscitation in cases of cardiac arrest and near drowning. CPR and resuscitation has been prevalent since the 1700s, but it wasn't until 1891 when Dr. Frederick Mass performed the first compression on a human being. In 1960, CPR was officially developed by the American Heart Association, or the AHA. The AHA in 1960 began programs to acquaint physicians and the public with CPR. Since 1960, the AHA has developed several protocols for infant and children resuscitation. They have also debated back and forth whether circulation, breathing, or airway was more crucial in times of resuscitation. In 2008 and 2010, the AHA put this debate to rest, rating circulation as the most important factor. CPR is fairly simple to perform. The most important skill you will ever learn is when to perform CPR. The AHA recommends that for bystanders, they first check for the 3 C's: check alertness, call 911, and compressions. According to the AHA, if there are no signs of choking and the person has suddenly collapsed, it is recommended that the bystander not check for a pulse or immediately clear the airway. Circulation is the most important and the first part of performing CPR. To perform a compression on an adult, put one hand over the other, interlocking fingers. Lock your elbows, and when doing compressions, bend at the hips. This is to make sure that you don't get worn out after several minutes of compressions. So you place your hands in the middle of the sternum or just about below the nipple line. Bending at the hips, press the sternum in with your hands at least 2 inches. Then let the chest completely recoil before pressing again. This is done 100 times per minute. Rescue breathing and clearing the airway are the next parts of CPR. If you are unsure of your skills or untrained, do not perform the next steps. Continue compressions only until help arrives. If you are trained or a responder, perform the following steps for rescue breathing. After completing no less than 30 compressions, use the head tilt, chin lift to open the patient's airway. When you do the head tilt chin lift, make sure that your hand is only on the bony part of their chin. For no more than 10 seconds, with the head in this stiffening position, check for breathing. Put your ear and your cheek as close to the patient as you can, listening for breathing and watching the chest rise. If the patient is only gasping or not breathing at all, give 2 mouth-to-mouth rescue breaths, keeping the person's nostrils pinched to help effectiveness. For any reason, if you feel the breaths are ineffective, do not delay compressions. Continue compressions only or give 30 more compressions followed by 2 rescue breaths. CPR was founded on the knowledge of the importance of keeping the brain and vital organs alive. Compressions work by pushing the heart to force it to contract. The forced contraction pushes blood out of the heart and towards the vital organs. During chest recoil, the heart refills with blood. As the compressions are done repeatedly, it pushes more and more blood to the brain, lungs, and to the heart. Rescue breathing, although deemed not as important as compressions, is vital. When pushing air into a person's mouth, some of the air goes to the lungs, which in turn will oxygenate the blood that is being pushed to the vital organs. However, some of the air does go to the stomach. This is why the head tilt, chin lift method of opening the airway is important. This method includes or partially blocks the esophagus, which runs to the stomach. By occluding this, you are pushing more air into the lungs instead of the stomach. In conclusion, let's review some of the main points. CPR was officially founded in 1960. It is a fairly new medical procedure, but it is the most important you will ever learn. Whether you are a doctor in a hospital or a family member who just watched their loved one collapse, CPR is the first step to resuscitation, and compressions begin that step. Thank you.